Record. Hey, Craig, I'm here with Anna Moore. She's going to talk to you about what she does. And she's been a big part of speaking with our class for many years. And so, Anna, thank you so much for taking the opportunity to talk virtually to my kids. And there will be a spot at the end once I post the video that they will be able to type in questions after they've watched the video. And then what I could do is I could just email them to you and on your own time, send them back if you get the opportunity, if that's all right.
All right.
I'm going to go missing here in a sec.
Sounds good. Thank you. All right. Hi, guys. Sorry, this is a little unusual of a presentation, but my name is Anna Moore. I'm a physician assistant. I currently work at Steadman Hawkins Denver, which is a sports medicine clinic. It's right off of Dry Creek, like on the east side of the highway across from IKEA. So that's part of the CU Medicine School, School of Medicine and CU hospital system. But I kind of want to talk to you today about what it is to be a PA, how I got here, and just the process of getting into PA school, going through PA school, and then after PA school, because I did not know what a PA was when I was going through school and in high school. It wasn't really until I was in college that I learned about PA, and I found that it was a great fit for me. I knew from a very, very young age that I wanted to be in medicine. I knew since I was 3 and since I could remember that I wanted to do something in medicine, but I never really knew what role that was until I was older. So we're going to talk first a little bit about what PAs are. Oops. Uh-oh. There we go. So, what do you know about physician assistants? This slide is just to kind of get you thinking about when you've interacted with a PA in your life, or whether that be in the community or through your doctor's office, and what that interaction is like, what you know about them. Because I found in the older populations, they know not very much about PAs and what we do, because we've, in the grand scheme of medicine, thinking back thousands of years, PAs are relatively new. So I found that younger people usually are, kind of in tune with what PAs are and what PAs do, but not necessarily the older population. So just kind of thinking about your interactions with PAs in the community, if you have had one, and what do you know about them. So we are licensed healthcare professionals. We practice medicine as part of a team. So you'll see a lot probably through these presentations that medicine has moved away from the hierarchical model where it's, doctors are at the top and everyone else is below them and it's kind of authoritarian. We've really moved toward a teamwork-based approach because they found that outcomes are better, it's a little safer for patients, and then it's no one person making an error or no one person doing a great thing. It's kind of a team approach. So PAs are part of that team. We're just on the lines just like everybody else, and we just have a very specific role to fill just like everybody does. So we practice medicine with physician supervision. And the reason I put this in quotes is because supervision is kind of a loaded word. Supervision can mean a lot of things, and that doesn't mean that I have a physician looking over me all the time. So for example, in my clinic, I have 3 days of, just regular clinic where I'm seeing patients in the office and doing checkups, and my surgeon is only with me for a day and a half of those. So the rest of the time I'm on my own, I'm seeing my own patients, I'm doing my own thing. He's available for me if I need to or have a question, but otherwise I'm pretty autonomous, which is cool. So supervision means different things. The state kind of defines what supervision means and that I have to have a physician on my license in order to practice, but it doesn't mean that I have to have somebody looking over my shoulder all the time. I can be independent in many ways, which I like a lot. So like I said, we have autonomy in medical decision-making. We provide a broad range of diagnostic and therapeutic services. So anything from taking the patient in, getting the history, doing the physical, to interpreting tests and MRIs and lab work, diagnosing, and then coming up with a treatment plan. We do all of that. We also work in education, research, administration, which is nobody's favorite thing in medicine. Nobody got into medicine because they like paperwork, but we have to do it too. Most of the PA faculty I went to school with were physician assistants themselves, but we did have some MDs on our faculty. And then PAs also participate in research. So there is a wide range of things you can do with a PA degree. But like I said, we're an integral member of the team. So Like I said, we can do everything: physicals, histories, diagnose and treat, order, interpret tests, counsel on preventative health care, assist in surgery, prescribe medications. We can prescribe all medications, including narcotics. We have no limit. I think in the state of Colorado, PAs are not allowed to prescribe medical marijuana, which is fine with me. I don't want to or need to, and it doesn't make a difference. So I think that's the only limitation on our prescriptive authority. So some of you may know this, PAs originated in the military. Kind of in the 60s, they were looking for a way to bridge the gap between Army medics coming back from combat or just being in the service and civilian life, because they knew that these people had really good experience and were very knowledgeable and very smart. But a lot of them were maybe older and didn't want to start all the way over and go to medical school. So the physician assistant career kind of started as a way to bridge that gap and get military medics back into civilian life in a role that was suitable for them. So I always like to go over this every year. There are some myths surrounding PAs that I always like to debunk before kind of moving on and talking a little bit more about what we do. So physician assistant is not possessive. So it's not physician's assistant. And this is something we deal with all the time. We see this mistake a lot in news articles, in magazines. Some surgeons and physicians even say that too, that it's just kind of an old-fashioned term. And it's a little bit nitpicky, but we're not the physician's assistant. We're not just there to assist the physician. We are there to extend the physician. So that's kind of a little myth there. Some countries call us physician associates. Another word is advanced practice provider. You may hear that a lot. APP, or advanced practice provider, is kind of a umbrella term for nurse practitioners and PAs. So that's one. And I think nurse anesthetist may also be kind of under that umbrella. It's a little bit of like an advanced medical degree, but not a doctorate. So there's that. PA isn't a stepping stone career to being an MD or a physician. So I get asked a lot, when are you going to go back to medical school, or when are you going to get your real job? And I chose to be a PA for a very specific reason. I found that it was the right fit for me. I think that's really important, is just finding the role that fits for you. And we all, like I said, have a role to play. So it's not a stepping stone. It's not a first career before I decide to go back to medical school. It's just the role I chose. Just like nurses want to be nurses and doctors want to be doctors, we all have our niche. Like I said before, we can prescribe medication, narcotic medication too. PAs aren't brand new. We've been around since the 1960s. So some people think it's a relatively new development. And, like I said, in the grand scheme of things, it is relatively new, but, that's over 6 years. It's been around now. So, and then the one I get a lot too is that PA school is easier than medical school, and that I just wasn't smart enough to get into MD school. So that's why I'm a PA. And that's not true at all. The didactic curriculum, which is our classroom portion of education, is virtually the same. We took a lot of the same classes as our MD associates. Drinking from the well of information, which is really like drinking through a fire hose. It's a lot of information thrown at you all at once, just like medical school, same as PA school. It's intense for a few years. And at CU, the acceptance rates between the PA and MD program are the same. They're about 3.8%. And actually, I need to update this, but this year I just looked at the statistics from the class starting PA school this year. And the acceptance rate, I think, was 2.7%. So it's even harder than it was before. So yeah, this is what you expect when you go to school, that you'll be given kind of dabbles of information, and it'll be really easy to take in. And then this is really what it's like. It's intense. It's very intense. For 2 years, we have classroom education at CU in the PA program where I went. So that's that. And where do PAs work? So we work everywhere. That's a great question I get asked a lot. Are we only in certain specialties or certain areas of medicine? And that's, I guess, also a myth, is that we work everywhere. So a lot of PAs are needed in primary care. That's just an area of great need in general. But I personally work in surgical subspecialties. I work in orthopedic surgery and sports medicine. So that would be that 23% there. I have a lot of PA friends who work in emergency medicine. We work all over. And then where do we work? So you can see that Colorado has quite a few PAs per capita. It seems to be kind of on the coast. The coastal cities and the coastal states have kind of higher concentration of PAs, but we're kind of wherever we're needed. We're in all 50 states. Again, some international practice for PAs, and we can talk about that a little bit later, but we practice everywhere. Colorado does have a pretty saturated job market. It's a place where everybody wants to live and everybody wants to work. So it's a little bit tough here, but yeah, there's a lot of states where you can be kind of a rare find for a lot of surgeons and physicians, which is great. So this slide I really like because it kind of tells a story, and that this gentleman here in the white coat is, it's kind of hard to tell, but his jacket says PAS, which is a PA student. And I think that's really beautiful about being a physician assistant, is that because our education is a little bit shorter, it's a master's degree as opposed to a doctorate, we are able to be a little more flexible in our careers and in our lives. And I went to PA school with people in their 40s, 47, 48. And actually a couple of them were former high school teachers. So for them, it was a second career. Medicine was always something they wanted to do. And they felt like they were able to do it because our education wasn't quite so life consuming. And so I really like this picture because it shows that this man decided older, you know, at an older age, later in life, that he wanted to change careers. And I think that's awesome. So, so if you're interested, I'm just going to glance over this slide very quickly, but if you're at all worried about job security, you know, obviously being in medicine is a pretty secure job in general, but PAs are one of the fastest growing careers. It's always ranked on like Forbes top 100 jobs to have. It's just, as far as pay, education level that's required, and work-life balance, things like that, it's always up the top. So you can read over all those, you can pause if you'd like, but that's just kind of a fun slide. It's a great job. All right, and then always the concern too is, if you had to do it all over again, would you become a PA? And that's what really turned the tides for me as far as deciding what I wanted to do. I didn't talk about this, but I went to Chaparral High School where Mr. Sturp used to teach, and then I went to University of Colorado at Colorado Springs, so UCCS, and got a degree in human biology and minored in Spanish. And while I was there, I scribed. I was a scribe in the emergency department for about 3 years. And as a scribe, you document for the physicians on a computer, and you help them with their paperwork and documentation and billing and lab ordering and all of that stuff. So that was a great kind of introduction for me into medicine. And up until that point, I thought I wanted to be a doctor. I didn't really know, you know, other than doctor or nurse, I didn't know other jobs. So while I was at this job as a scribe, I worked for about 25 physicians and about 12 PAs. And I just asked all of them, if you had to do it over, would you do it again? Would you be an MD? Would you be a PA? And overwhelmingly, the physician said no, that they had their work-life balance was lacking. They were stressed. You know, they still had medical school debt, or for some, whatever reason, a lot of them were unsatisfied. Excuse me. And the PAs were all overwhelmingly yeses. They all said, yes, I would absolutely go back and do it again. In fact, some of the MDs said, if I knew now what I knew then, or you know what I mean? If I had known then what I know now, I would have gone back and been a PA instead of an MD. So that really got me thinking and kind of changed my mind into the PA path. So anyway, if you had to do it again, would you do it? Most of my colleagues say yes. The main things are, we get to practice medicine, which was what I wanted to do. We get to grow our scope over time. So that means with more experience, I get more responsibility. So that's also nice, because then I'm not expected to do something that's out of my comfort zone, and I'm also not doing something that's really boring and not fun for me. I get to kind of grow with my experience. We have kind of less administrative responsibilities. So my physician who I work for, he also is the lead physician for the Broncos. So he does a lot of meetings, a lot of administration, a lot of just time in other areas that I would rather be spending with patients. So that's kind of nice. And then the nice thing, that one of the biggest things, and actually a huge thing for me, was as a PA, you get to change your specialty. So I didn't really know what I wanted to do. I thought I maybe wanted to do emergency medicine, but I knew that I'm a relatively indecisive person, so I was worried that if I specialized in something as an MD, I would change my mind and be unhappy later. So as a PA, we are free to move about from any specialty we want. So right now I'm in orthopedics and sports medicine, but if I woke up tomorrow and said, you know, I think I want to try family practice or dermatology, I could do that without any extra training. I would just have to find a job. So that's kind of cool. And then this is just another kind of, if you're interested slide. We get these sort of censuses every year from the AAPA, which is the American Academy of Physician Assistants. And it puts out data on all the statistics you've seen so far are from that report. So this one is just a salary report. You can see kind of the 50th percentile for salary in Colorado and what that looks like. Colorado is one of the lower paying states as a whole. This is only kind of alphabetical, so you don't get to see all 50, but again, because we are in high demand, we're kind of saturated here. It's a very popular state to live in. We're paid a little bit lower here than in other states, but overall for 2 or 3 years of school after college, it's a pretty darn good salary. Very livable. And then this is just median salary by specialty. So obviously higher risk specialties, higher intensity specialties are paid more, and that goes for MDs and PAs. So they kind of mirror each other as far as pay, where family practice and primary care are the lower paid specialties, kind of universally for MDs and PAs. And then higher things like surgical subspecialties, which is where I work, is the second from the top, and then emergency medicine is the top. So kind of gives you an idea of specialty-based pay. So, okay, you want to be a PA. How do you become a PA student? So you have to complete at least 2 years of college science classes. I think actually all programs require a bachelor's degree now, and most people have some kind of medical experience. Some programs require it in order to apply. CU, where I went to school, does not. So I went to the CU PA program. It's on the Anschutz campus in Aurora. It's a 3-year program, and we'll talk about kind of time of programs in a second. But yeah, so it's just kind of dependent on where you apply. But the schools usually require a bachelor's degree in science classes, which is very similar for an MD program as well. And if you have, if you're curious about what the requirements are, you can always go to the website for the med school at CU. And then anybody who wants to do any kind of medical stuff later on has to keep an eye on your prerequisites, make sure you're meeting the prerequisites in order to apply. I'm on the board right now for applications for the PA school, so I'm looking over everyone's applications, and I have to make sure that they have the proper minimum requirements in order to apply, as well as their other things like being well-rounded, doing extracurriculars. Did they travel abroad while they were in school? Did they volunteer? Did they do extra things, which I'm sure if you're in this class, you've already got that covered, but it's just something to think about. Keep that in mind when you're going through college and in the next few years. And then I think the biggest thing is just get some experience. So for me, I didn't know what I wanted to do until I actually was out working in medicine and got some experience, but you can volunteer, shadow, work during college like I did. It's really important to know what you want to do and why you want to do it. So especially for PA programs, a big part of the application is why PA and not MD or nurse? Why do you want to do this role specifically? And that's really important to be confident in your decision and understand what you're getting yourself into. So for PA schools, we take the GRE, which is the graduate record examination. It's a kind of standardized test for graduate school. So that was sort of my backup plan if I didn't get into PA school, was to apply to a public health program first and then do a master's in public health and then go to PA school. So the GRE took care of that for me. That was the entrance exam for both, where for MD programs, the MCAT is specific to MD programs. So there's kind of no backup option. Just something to think about. So this surgery, or this picture, I just like, it's surgery, and I just think it's really nice because in this picture, you can't tell who the surgeon is, you can't tell who, you know, the PA is or whatever, the SA, the surgical assist, it doesn't matter, we're all working as a team. So that's how it is in surgery. Like if my surgical tech needs something, if they need to go to the bathroom, I fill in for them. If I'm just in a better position to do something or drill something or hit something with a mallet, my surgeon lets me do it. It's not like I'm the surgeon and I can only do this. We all work as a team, which is great. Okay, so you're in PA school, what's it gonna be like? So PAs are trained in the medical models. So we are trained in a similar way to MDs, like I said before. It's meant to complement physician training since we're supposed to work with them very closely, where nurse practitioners who are also mid-level providers or advanced practice providers are trained in the nursing model, which is a little bit different than MDs. So just if you're kind of more interested in one or the other, you can kind of look up the difference in the training, but PAs are trained more on the medical side. And at CU, the PA program is under the umbrella of the School of Medicine. So in the CU PA program, I was in the School of Medicine at CU, but just in the PA program, where the MDs are in the MD program, if that makes sense. The programs range from 18 to 36 months. The average is 26 months. My program is 36. My program is the longest, which it just depends. It's personal preference. So, you know, my training was a little longer. I went straight through from college, from undergrad to PA school. So I was very young. I was on the younger side of my class. So I think having that extra year was very helpful, but that's also something to think about, right? Like, would you rather take a gap year and get some experience or work, or do you want to just go straight through? And then the difference in training and the length, that's all something to think about. There are over 160 PA programs in the nation, which is crazy. That's a lot. I think Colorado has 3. We have CU, Red Rocks, and Rocky Vista. But I think there may be a 4th coming. I'm not positive. But anyway, we have 3 now. When I was going to school, we only had 2. Rocky Vista wasn't around yet, but they're all great schools in Colorado. PAs, when we're going through school and training, we're trained in general medicine, so not a specific specialty. We're just trained in medicine. Our program at CU has a little bit more of an emphasis on pediatrics, where a lot of programs sort of glance over that. We had a little bit of extra training because the history of our program was a sort of pediatric program. So they were sort of keeping that as a part of the history of the program. So just every program's different. There are some programs, like there's one in Alabama that's surgical kind of specialties only, or trains you for surgical specialties more than others. So every program is a little bit different. Currently, there are no online programs available, although now with COVID, almost all the programs I think are going to an online model, at least for the time being. But it's not like online school or remote school that you can do. You have to be there in person. It's a lot of hands-on stuff. I think there are some nurse practitioner schools who do online, but for whatever reason, they just sort of decided that PAs weren't going to do online. And then specialty training. So my specialty being orthopedics, that all occurs on the job. So I was hired and then trained in the fine details of what I would do as an orthopedic PA when I was already hired and had a job. So that's kind of different and interesting because it can be a little bit hard to get a job as a new graduate, especially if you're looking for a subspecialty job. But it's nice because you're getting paid a full salary. You're not taking like an internship salary. You're not taking a pay cut. You're kind of learning as you go. And honestly, for me, it did not take very long to get up to speed and know everything I needed to know to be able to support my team and my surgeon. So there are some postgraduate programs or fellowship programs. They're usually a year long that occurs after you're done with PA school. And that's just kind of a little more specific training. So critical care, emergency medicine, surgery, those have fellowships, but it's a little bit less pay. So they're a little bit controversial in the PA world because they think, well, if we're meant to have on-the-job training, why would we take a pay cut to work twice as hard for just a fellowship? So just depends. I kind of have no opinion because I didn't go through one, but and there are about 37 postgraduate programs in the country right now. So this is just kind of a fun interlude. This is me during PA school. We had a lot of these labs where we would learn different techniques like placing IVs, doing ultrasounds, doing trauma stuff. This was a casting workshop that I did. So I didn't know at the time when this picture was taken that I would be doing orthopedics, but it came in handy. And this man right here on the side in the blue scrubs, he was a resident at the time. And then when I got a job as a PA in orthopedics, I worked with him when he was finishing up his residency training. So it kind of came full circle, which is kind of cool. Okay, so you went through PA school. You have to go to an accredited PA program, which most of them are. We do have national board certification exams, so very similar to physicians, we have to take our boards. That happens at the end of your PA program. We complete 200 hours of continuing medical education. Actually, I think it's 100 hours every 2 years. That may be a typo. And then we have to recertify and take our boards every 10 years. So The continuing medical education requirements, the recertification requirements, those are exactly the same for MDs. It's very similar. And then we have to have a license. So I have a medical license in Colorado. I have a DEA license. We have to have all that same stuff. This is another kind of fun interlude picture. This is a picture of the CAPE, which is the Center for Advancing Professional Excellence. And it's basically just a giant simulation lab. So we have like operating rooms, we have trauma rooms, we have delivery rooms, and we have these high fidelity models or mannequins that can do everything. They can vomit, they can bleed, they can give birth, they can fake a heart attack. You can intubate them, you can do CPR on them, you can do trauma exams on them. So we did a lot of these simulations through school. For whatever the reason, the PA program has more of these than any other program. So that's kind of a fun part of school, is to do these simulations, and you're being watched by the faculty on cameras and microphones. So it's pretty crazy, but that's pretty cool. If you ever have a chance to check out the CAPE at the CU Medical Campus, you definitely should. So this is all stuff, you know, I'm going to go over this very quickly. You can pause this if you like, but it's just kind of how to prepare for your education in college and beyond. So, you know, clubs, like I said, volunteering, all those extracurriculars are great. And then this is just my PA class. So I'm right here down in the middle. This was back in 2013, this picture was taken. So it's been a little while now. This is our white coat ceremony. So it's kind of a rite of passage in medicine that when you move from your didactic or your classroom curriculum into your clinical curriculum, you are given a white coat. And students wear the short white coats that cut off kind of at the waist, like shorter like this. And then when you're a fully fledged provider, you get a long white coat. So this is at the very beginning of our training when we started doing clinical rotations. We started them right in our first year, which is kind of unique for PA programs. And when we graduated, we got our long white coats, which was very cool. And then this is just, again, I'll kind of glance over this briefly, but it's just applicant statistics if you're interested. Again, these have changed a little bit. This was just for my class in 2016. How many people matriculated is how many people came into the program versus how many people applied. So again, pretty competitive, but not impossible to do at all. And I'm also happy, I've been mentoring a few people through the process who have been in college to apply to PA school. So if you're interested, I'm always available. Again, I'll just let you pause this. This is just statistics on average age, how many were in state versus out of state, what our GPAs were, what our GRE scores were, just kind of statistics if you're interested. This is just a breakdown of classes that we take while we're in PA school. So the first year is very much basic kind of science classes, and then second year becomes more actual medicine based and like practical applications. So clinical medicine, pharmacology, emergency medicine, all of those things. So that's fun because then it becomes more real and you see how to apply the science that you learned in the first year. And then the third year, the entire third year of PA school is rotations. So that means it's 11 months, 11 one-month rotations of various things. There are certain requirements from our National Accrediting Association of what rotations you have to have. And then there are some elective rotations. So I did all of my elective rotations in surgery because I knew that's what I wanted to do. And then in that whole year, we were only given a 2-week vacation. So it was a very long, very hard year. We worked whatever hours, nights, weekends, holidays, overnight on-call, 30-hour on-call, crazy stuff. But it was fun. And that's when you really get to apply what you've learned. So this is a nice slide. This is comparing MD and PA. Again, it's kind of a lot of words. I'll let you look over it. But just the year difference. So 4 years of medical school plus residency, which ranges anywhere from 3 to 7 years after your medical school education. And the didactic, again, is your classroom education. So very similar between MD and PA. MDs have only one specialty. We can do any specialty as PAs. MDs obviously make more money. They've worked a lot harder. They've gone to school longer, and they're much more specific and subspecialized, which is why they have their role, and ours is a little more general, so we have a different role there. And the other big thing is a lot of PAs aren't recognized worldwide, so you can't go to any country in the world and say, I'm a PA, and they know what you're talking about. But if you say, I'm a doctor, pretty much everybody's going to know what you're talking about, no matter where you are in the world. Okay, so like I said, on-the-job training in any specialty, we extend the practice of the physician. So surgery, where I work, orthopedics, I'm first assisting in the OR with my surgeon. I'm doing pre and post-op visits in the clinic. I'm writing medications. I don't think my physician hardly ever writes for medications. I do most of the prescribing. If we have a patient admitted to the hospital overnight, which doesn't happen very often, we round on the patient in the hospital and see them every day, and then just take care of them throughout their time, kind of around surgery, which is what perioperative means. It's around the time of surgery. And these are just some fun pictures. This one is me in lead, which is the protects you from the x-rays. So we wear a lot of lead in surgery for orthopedics. This was pre-COVID because I'm not wearing my big face mask, but in my pretty pink lead. And then this is me hanging out on the porch in a hammock, kind of taking it easy after long days because of COVID. I'm not on the front lines, but we have had a lot of intense days from catching up from all the backlog we've had. So those are kind of fun. All right, so my job specifically, I work for an orthopedic sports surgeon. We do anything from acute injuries to chronic pain. We do shoulder and knee mostly. So those are kind of the two joints that we focus on. But we can see any joint. We just may not be able to operate on them. And my role as a PA is to care for my patients in clinic and in surgery. So I kind of already talked about my schedule in clinic. And then, so that's Monday, Wednesday, Friday, I'm in clinic. And then Tuesday, Thursdays, we're in surgery. So we see everybody from like 13 years old and up. I assist in surgery, and I'm just there to extend the reach of my position. So especially working for the physician of the Broncos, he's often away traveling or working for them at Dove Valley or doing different kind of things that they need him to do. So I'm there to be there when he can't be, which is a huge part of being a PA, is just sort of to extend the physician. Okay, so here's a couple fun case studies if you guys are interested. Sports medicine, we'll go through these very quickly, but just kind of get you thinking medically, get you thinking about what you would do. So this is a 16-year-old female. She comes in with some right knee pain. She has no medical history. Her history of the current injury or history of present illness is that she was running drills at basketball, pivoted, felt a pop in her knee. She has pain, swelling, and can't move, decreased range of motion. So on exam, she's swollen, has an effusion, which is fluid in the knee. She's got decreased range of motion, and she has a 2B Lockman, which means when I test her ACL, it's really soft, like there's no ACL there. So we get an MRI, and this is right where the ACL should be, right there. That's her PCL there. ACL is gone. So what do? We have to fix it, right? So that's what Dr. Boblik and I do, my surgeon. We go in and we fix it. So this is kind of an option here. I already gave you guys the answer, but this is, what would you do? Would you not fix it, or would you fix it? We're going to fix it. Surgeons want to cut, right? That's our job. So we would use her own tissue, which is an autograft. We like to use people's own tissue whenever we can. And this is a picture of an ACL graft that I made. So my job in surgery is to prepare the graft. So the surgeon is drilling the holes and getting everything ready. And I take the patient's tendon from another part of their body, from another part of their knee, and I clean it up and fix it up and get it ready to go back in to be their new ACL. So this is my handiwork. It's pretty pretty. It's pretty pretty. It's nice. All right. So yeah, this is just kind of a day in life. This is, again, just sort of, if you're interested, usually arrive at work at 7. I pre-op my patients, consent them for surgery. We start surgery around 7:30, which is when we started today. So I assist in cases. Cases are surgeries. I prepare the ACL, I close, so I suture up at the end of the case while my surgeon is out doing the next thing. I apply splints, or if I have to make a cast, I'll put that on in surgery. And then kind of throughout the day, I'm prepping my patients for clinic the next day, writing prescriptions, calling other patients of mine to say, hey, you tore your ACL, we need to do surgery, and doing things like that. And then at the end of the day, I just kind of sign out with my physician. So today, this says 5:30. Today, I didn't leave work until 6 or 6:15. So it just depends on the day. Here's another case study. This is a 45-year-old male with left elbow pain. He was helping a friend move. The friend dropped there into the bookcase. So this guy had a really big eccentric load all of a sudden on his arm, and he felt a pop in his elbow. His history is hypertension and asthma. Vital signs are stable. He's got some bruising and swelling around his elbow, and his biceps tendon in the elbow is gone. I can't see it, and he's got a deformity. So this is what his elbow looks like. So he's bruised, and his biceps is like all bunched up here. So that's not right. So this is what I love about orthopedics, is that anatomy is your friend. And if you just think about anatomy, you can figure out the pathology pretty easily. So This guy tore his distal biceps tendon down here at the elbow, and that means that all of these muscles, because they're under tension at the shoulder, they've scooted up and are stuck up at the top, so it makes that Popeye deformity. So we would go in and fix that, because you can see here he only has one tendon attachment down at the elbow. Up at the shoulder he's got two, so if he loses one of those, he's going to be fine. And if any of you grew up in the time of John Elway, he tore one of his biceps tendons right before the 2 Super Bowl years. This is kind of like a big sports lore thing. Like, everybody knows about this. And he threw fine. He threw these rockets. We won the Super Bowl 2 years in a row. So you can survive with a biceps tendon up here. You can't survive with it so much at the elbow. It doesn't work. Okay, so kind of to wrap up everything we've talked about, points to consider for being a PA, or kind of in general when you're thinking about what to do in medicine. PAs have the freedom to move between specialties, which for me was a huge thing in choosing to be a PA. We have great job satisfaction, a huge scope of practice, meaning I can do a lot of stuff. We do require supervision from a physician, even if it's indirect. So if that bums you out, probably not the right role for you. It's a high stress career, but medicine is, in general, no matter your role, medicine is just a high stress career. It's people's lives. You know, you're not just studying on your test for the grades, you're studying to help somebody and save somebody's life potentially. So that's just kind of comes with the territory. There are opportunities for international practice as a PA. We exist a lot in the UK and Canada. Australia is also very big on PAs now. So there is option to kind of move around, but very limited compared to MDs. And then the best part is we're out of school practicing medicine in 2 to 3 years after college. That means less student loan debt and just kind of enjoying your life. So I was done with school by 25, and then I've been working ever since then and having a great time. And like I said before, there's great projected growth, great need for PAs in the future. We're kind of printing our own money. We're just going to be needed for a long, long time. So speaking of international practice, this is a picture I like to share. This is me in Guatemala in a small kind of rural village doing a month rotation in a clinic there, taking care of patients, which was really cool because I got to expand my Spanish and do medical Spanish, which is a whole different side of Spanish, as well as learn about international medicine and, you know, the poverty that comes along with, and the medical issues that come along with poverty, and just practicing in a much more limited space and limited resources. So that was a cool, happened in my PA school education. So there is opportunities for international travel, which is great. So that's it. So if you have any questions, you're always welcome to email me. I'm all about being available and shadowing. If you guys are interested in shadowing, if you're over 18, you can shadow me. CU has a limit on 8 hours. So we can only do 8 hours, but we can make it work. Or if you have any questions in general. And then there's some more resources. AAPA, CASPA is our application, and then Reddit has a great pre-PA subreddit. Thank you.
Great job. Great job. So the kids will ask questions at the end of this, and I'm actually going to stop recording at this point.